Assalamu alaikum wa rahmatullahi wa barakatuhu. We hope you're all doing well and you've enjoyed the sessions that you've attended so far. I would like to start off by thanking each and every single one of you for attending. You know, we like doing this careers fair every single year. This year we have been unable to do so in person, so hence the reason we are going virtual. I'd like to introduce myself. My name is Bilal Abdul Halik, and I am the chair of trustees at Spot Project. One of my other roles is I work as a science teacher across a primary school, secondary school, and sixth form. And one of my roles involves being a director of careers. So throughout the past few years, I've been directing students towards certain careers, giving them advice and helping them get to reach their destinations. Now, one of the aims of this careers fair is to address that gap of, the lack of opportunities out there. Because what it is there are so many opportunities out there, and there are so many people who are looking for employment, looking for job routes, looking for industries, but there's this big gap in the middle. Now, we want to address this gap, and that's what we're aiming to do today. Now, in this segment, we're going to be talking about medicine, dentistry, nursing, and other routes within the field of medicine. I'd like to now start off by introducing some of our panelists. Within this session, we have two doctors, Dr. Amin and Dr. Saad. We also have two dentists, Dr. Zain and Dr. Tasnim. We have a pharmacist, Dr. Fayaz and Dr. Faiz, and we have a nurse called Sarah. So I'd like to start off by going towards the panelists. If we could start with Dr. Tasnim. If all of the panelists could introduce themselves, tell us a little bit about themselves, what they do, and a short glimpse of what their journey was like and why they chose that specific field. So Dr. Tasnim, we'll go ahead to you first.
Everyone. Can you hear me okay?
A little louder, if you could put the volume up a little louder.
Can you hear me any better? Is that better?
Yeah, that's fine.
Okay, so my name is Tasnim. I'm a dentist. I practice in a general dental practice, and I've been doing so for around 10 years now. I graduated from King's College London in 2010, and I've worked in a few different dental practices since then. Yeah, so I went into dentistry because I was really interested in working with people and being able to help others. And this profession worked for me because of its flexibility, and sort of in the long term, I was looking for that as well.
If we pass over to Dr. Faiz.
It's Faiz, actually. I'm a pharmacist, a clinical pharmacist. I work in general practice alongside GPs, a relatively new role for pharmacists. I've been qualified over 10 years. I've worked in different sectors, including community. I graduated from London School of Pharmacy, which is now part of UCL. In terms of going into pharmacy, a lot of people, it's normally an afterthought for a lot of people. If they don't get into dentistry or they don't get into medicine, they often fall into pharmacy. For me, it wasn't the case. I chose to do pharmacy, and it's been a fruitful career. And I think now more than ever, the career options for a pharmacist and the progression for a pharmacist has improved. So I would say it is a profession which is expanding in its roles. And it is something which I would recommend. You get the whole benefit of seeing patients clinically without, I would say, to some extent, the pressure which you tend to get being a full doctor, so to speak. The doctors could probably vouch for that. But yeah, it's a good profession, and I'm open to questions, of course, afterwards. Thank you.
Jazakallah khair. If we could go to Dr. Zain.
Yeah, assalamu alaikum, everyone. So I qualified from King's in dentistry last year. Finished my year in practice, it was my DFT year in the summer, and then just started a job in oral surgery and max fax at Ipswich Hospital. So it's a form of like core training that you do if you want to specialize. So if you don't want to be in practice, you can start the specialization route. So you do like a couple of years in hospital, various hospital jobs, and then you work your way up to like registrar and then consultant essentially. I did a degree in biomedical science before that as well, also at King's, which was a lot of fun. And during that time, I got a lot of work experience, did a lot of like extracurricular stuff, then applied for dentistry, got into that, and then just finished 5 years now. Obviously with Corona, it was quite different in practice this year. Like we stopped in March, and we're doing everything remotely, and we're not clinically essentially in practice, just triaging from home. And then now things have gone back to normal more or less in practice, seeing emergency patients, and in hospital now I'm focusing more on oral surgery, so like taking teeth out, seeing kids, doing biopsies of like of lesions and cancers and things like that. So it's good fun. Like it's very hands-on, of course, and very people orientated. Like half the job I find is just to do with communication and engaging with people, making them feel relaxed before any kind of procedures. Long term for myself, I hope to go into pediatrics or orthodontics, basically. So doing braces or looking after kids, hopefully in hospital. That's the plan.
Jazakallah khair. If we can head over to Dr. Saad.
Assalamu alaikum. So doctor to be soon, inshallah. I'm a final year medical student, haven't graduated yet. So I'm finally at King's. I've been at King's for like 6 years now. I had a slightly long journey because I initially applied for dentistry. Alhamdulillah, I got into King's, but I changed my mind. So I've had that sort of experience to applying to the other field as well. So one of the reasons I didn't go into dentistry was because I did not enjoy surgical aspect of dentistry. And then I took my time out, I took a gap year, reflected over what I wanted to do, and then decided to go into medicine with the hope of going into GP practice eventually and becoming a GP. So anyone who is doing work experience and considering if it's the right field for them or not, I would ask them to really do consider if it's something you would like to wake up every morning and go into it. Because if it's something you will not enjoy, then whether be it money or the name behind being a doctor, it's not necessarily worth it. So make sure whatever you do, you enjoy. So as I said, because I'm a final year at university, anyone who wants or does have questions about university life and how does it feel being at university and studying medicine, I can answer more of those questions, whereas my colleague Amin, who graduated last year, I think he can answer more of the actual working aspect of a doctor's life.
Jazakallah khair. If we can go to Sister Sarah next.
Assalamu alaikum. I'm a third year student at King's College, and I'm currently studying mental health nursing. Initially, I went into nursing because I really enjoyed science, and I did BTech Health and Social Care and Applied Sciences. I knew that I wanted to continue studying, doing that, and possibly go into psychology, because I know I didn't do that, and it was something that I sort of regretted, and I wish I did psychology. I wanted to go into something that would help people, and I know that I wanted to make a difference in people's lives and not just like sit behind a screen and do nothing, or like sit behind a screen and just, I wanted to do something that was quite proactive. And so I went into nursing, and so far it's been really good. It's got its positives and negatives, but it's been really good overall. And yeah, don't know what else to say.
Jazakallah khair. If we can head over to our last panelist within the session, Dr. Amin, if you can introduce yourself, tell us a little bit about your journey, a quick glimpse.
Assalamu alaikum, my name is Amin. I'm a foundation year 1 doctor, so I've just finished university. I was, as you call it, the class of COVID. So unfortunately, I didn't have a graduation of any kind. But alhamdulillah. I went to King's College London as well. So I went to university with Zain and Saad. And I'm currently working in Basildon University Hospital in South Essex. And yeah, if you have any questions that pop up during the session, specifically about medicine, whether it's applying, how medical school is like, or the job itself, then I'll be very happy to answer, inshallah.
Jazakallah khair for that. We have been inundated with questions. So I'm going to go ahead and start the questions. The first one, if we can go to Dr. Tasnim. The question is, during COVID, dentists were at a high risk. How are they managing to stay safe now?
So we have had to implement a lot of measures. Dentistry is not the same as it was pre-COVID. For example, our dental practice is, the doors are completely closed. We have to triage every patient over the phone and decide whether they're to be seen in the practice or not. There's extensive amount of PPE that we need to wear in the practice. And there's very limited procedures at the moment that we are doing as well. So yes, dentistry is changed a lot. And yeah, it's to keep the patients and the staff as safe as possible. Inshallah, this time passes soon and we can get back to normal.
A question for Dr. Zain. The person who's asking this question is asking for a professional answer because they've been asked this during a mock interview. Hence, they are looking for a professional answer. The question is, why did the dentist choose the path of dentistry and not medicine?
So mainly it was the money. No, I'm joking. It wasn't the money. Essentially, the dentistry, I think I did quite. It was from my work experience, which really made me kind of choose between the two. With dentistry, I thought it was a lot more personal in the fact that you see your patients, for routine checkups every 6 months, and then whereas GP, you'd only see them really if there's a problem. And then with the dentistry, I like the fact that compared to say GP life, you could still be in a kind of a practice setting, like, have a practice, but be very hands-on. And I like the fact that you'll be doing like fillings, root canals, bridges, all surgery, all within a normal routine, like day-to-day basis. Whereas when I was in GP, from that work experience, I found it was a lot of prescribing and not as much as hands-on as I would have liked it to have been, which is why dentistry really attracted me at the time. And people don't realize, but there's so much scope to specialize within dentistry as well. People think it's just teeth, but within the mouth and teeth, there's so much that you could do. You can specialize within root canals, within oral surgery, within braces, within like oral cancers and disease of the mouth. So there is a lot of scope within dentistry, more than people may think it there to be, which is what really attracted me to it. So it's really just working within a team, within a nurse, frequent patient contact of all ages, and then getting really hands-on with your treatments on a normal day-to-day basis, whilst being able to specialize. It's like you can work a couple of days practice, a couple of days hospital, and do like 1 day teaching as well, all within a normal week. So in that regard, it's very flexible. Whereas as far as I'm aware, with the medicine, it's like you're either hospital or kind of GP. You can't do a mixture of both. But dentistry, you can do that. So I like that kind of variety that dentistry also gave you as well. And the fact that, it's very friendly in terms of balance, work-life balance. Like practice, I could be 9 to 5. You can also work Saturdays, Sundays. It all depends on what you want to do, really. Whereas medicine, I'm not sure it's as flexible as dentistry.
Thank you, Dr. Zain. Now, can I ask all panelists to be quick with their answers, because we have a huge amount of questions to get through, and I want to make sure everyone gets their questions answered. Right, the next question is for Dr. Amin, and it's a question that a lot of people are asking. two parts to the question. What are the working hours of a doctor, number one? And number two, this is a question that keeps on popping up. What is the salary like for a doctor? Over to you, Dr. Amin.
Yeah, so working hours are, they can be a bit unforgiving at times. And I mean, I'm currently on a surgical placement right now, and you're expected to work a minimum of about 48 hours a week, at least. And this is spread over, it could be 4 days in a week where you do 12-hour shifts each day, or it could be 5 days in the week where it could be 10-hour shifts each day. But on average, you're working about 48, 50 hours in a week. There are always the odd weeks where they are busier, so you could end up doing 60 hours. There are the odd weeks where they are a bit lighter, but on average is about 48, 50. And on top of that, there's also the option to take up extra shifts if you'd like to earn a bit more money. They call it locuming. So the options are always there. In terms of the salary of a doctor, I mean, I can only speak for a foundation year one doctor. The base pay for all foundation year one doctors is about £28,500. So that might seem a bit low. You know, you've been grafting at university for about 7 years, 5, 6, 7 years. So 28,000 isn't a lot. But what people forget is that you work weekends, you work nights, you work long days, which start at 8 a.m. and end at 8 p.m. or 9 p.m. So all those extra hours are counted as unsociable hours, and you get paid at a higher rate. So it can go easily upwards of 35 towards £40,000 in your first year. And then on top of that, like I mentioned earlier, you can locum and you can do the odd extra shift, and again, that adds on more. So the options are always there. Of course, you know, I'm not advocating that you do a course or a degree or a career just for the money, but you do get well remunerated if you choose to work a bit. Yeah.
Next question. Okay, a question that is for Dr. Saad and Dr. Amin. We'll get a quick answer from the two of you. What is a good score in the UK CAT exam?
You want to start, Saad?
Okay. So the UK CAT generally varies every year because it's dependent upon how the whole cohort scores. So in 1 year, the average score could be, let's say, around 600, and the top 3 deciles would be 630, and in other years it might be higher. So it depends on the average of your year, and that result is released by the UK CAT company that runs it. But the questions have been coming for KCL in particular. KCL, they use a sliding scale, which is known as comparing your GCSEs and UK CAT together. If your UK CAT is not amazing, so it's, let's say, mid 650, around 650, and you have amazing GCSEs, many A stars, Kings have a policy where they look at you in a balanced way. Whereas if you have a high like a low GCSE, like not amazing GCSEs, but a high UK CAT, then you can hope for Kings to give you an interview. So anything above 650 is a good score in general. Anything under 650, you might want to research more about the university's individual requirement and then consider applying to those ones.
Yeah, so like you said, 650 is a good score. And obviously towards 700 is ideal. At Kings specifically, so I know Asif's asked a couple of times now on the chat. Kings in specific, they would prefer to have obviously a 650 plus score. However, there are 2 courses that run at Kings. There's a 5-year program and a 6-year program. So the 5-year program is the typical medical program where you need, you got to do your personal statement, your grades, the entry exam, the UK CAT, and so on and so forth. You still have to do the same things with the 6-year course, but there's a lower requirement in grades and there's a lower requirement in UK CAT score. The only difference is that the medical program is a year longer, where you have sort of a foundation year almost, which bridges you into medical school before you start properly and go all the way through. At the end of the day, you have the same qualification, you've got the same medical degree. And in fact, I did that course as well, and so did Saad. So I started back in 2013. And and my UK CAT score wasn't the best. I had all the other aspects of it. I had decent grades at A-level. I had a good statement, I had the experience, but the UKCAT let me down. And so the 6-year course was a great avenue. You could go outside of London for some medical schools, and some medical schools don't even consider the UKCAT at all. Others consider only the BMAT. So the options are there, but definitely look it up because every year cutoffs and numbers change.
Okay, next question. It's quite a common question a lot of people are asking. So I'm going to do a quickly go through the panelists. If you can get a quick answer, we'll start by Dr. Zain, then go to Dr. Faiza, Dr. Tasnim, then Dr. Amin, then Saad, and then Sister Sarah. The question is, what A-levels are recommended to study for medicine, dentistry, pharmacy, and nursing?
So ideally you want the science subjects, so biology and chemistry, and then it can vary depending on the university itself what the requirements are, if they want another science, but they usually look for a strong A-level degree. So biology, chemistry ideally, which is what I did, and then physics for AS, and then I did economics as well. So those 4, so sciences ideally.
For myself, obviously several years ago, again, the sciences, chemistry and biology, maths is also counted under one of those sciences. They do like something like psychology in the dentistry degree because it means that, you know, you sort of got a all-round sort of coverage in your A levels. So I did do psychology to A levels, and they did like that.
Yeah, just to echo what everyone else is saying, definitely from the sciences. Chemistry, if you're considering pharmacy, there's a lot of chemistry involved. Physics is good, maths is great as well, because as a pharmacist, a good foundation in maths is fantastic to have as well going forward. So yeah, so sciences, maths, then really economics is something I did as an AS, which I guess if you do economics, maths, and 2 sciences, even if you don't choose a medical degree, you still got a decent A-levels to do something else. So I think that's quite a good options for everyone.
All right. So the way I advise people about A-level subjects, obviously you need the sciences for sure. You need biology and chemistry without a doubt. Back in the years, they only wanted biology and they could accept if you only had AS chemistry. So if you want to do medicine or dentistry, you need biochem, I think, across the board. For the 3rd subject, I tell everyone, most universities don't care much about what you have. So pick a subject, which is your strongest subject, which you enjoy and which you think you can get the grade required. So obviously you need minimum A, some universities want A star as well. So go for the subject, which is the easiest for you, most enjoyable for you, and pick that as your 3rd subject, and your first 2 subjects have to be bio and chem.
Yeah, I agree. That's what I did in A-levels. So I did biology, chemistry, which is the minimum. And then I did AS maths, and I went for ICT A-level as well. It's about being tactical, really. There's no point putting too much work on yourself. End of the day, if you do the hardest subjects and you get 2 A's and a B, and somebody else does the easier subjects and gets 3 A's, they're not going to look at the subject itself. They're going to look at whether you reached the minimum requirement, and if you didn't, then they're going to give it to the person who did. So it's a numbers game at the end of the day.
And Sister Sarah?
I did BTech Health and Social Care, which was equivalent to 1 A-level, and I did applied sciences, which was equivalent to 2 BTech, to 2 A-levels. But if you're not doing a BTech, you can get into nursing through biology and chemistry. You would need one or the other, or maybe even both. And something like psychology would be good, or sociology, but the sciences have to be there.
We're seeing a lot of questions being repeated, so I'll just answer some of them because the panelists have already answered them. People are asking what are the best subjects to study for routes along medicine. As the panelists have mentioned, sciences, biology, chemistry are powerful, maths is powerful, And then for a fourth A level, you can study subjects like psychology, history. They help boost your portfolio. Another question that people are asking is, what's a good UK CAT score? The panelists said anything north of 650 is a good UK CAT score. If you get a score under 650, it's not the end of the world. You can still have a look and apply for universities which have a lower requirement. For example, St. George's University, Keele University, and you can do some research to find other universities that have lower requirements. Some people are asking about the duration of the medicine course. It is 5 years, but there are also some universities which offer an extended medical year program, which is 6 years. King's University and Queen Mary University are examples of universities that offer the 6-year program. Let's have a look. Another question. Right, Dr. Faye's quick question. If you have a pharmaceutical degree, can you work as a pharmacist?
No, you need a pharmacy. It's a master's in pharmacy, after which you do a 1-year pre-reg training, and then you become a qualified pharmacist. It is a protected title, so unless you have a pharmacy degree and then register with the GPHC, you can't practice as a pharmacist. So you would have to do an MPharm course or a degree.
Jazakallah khair. Quick question for Zain. Were you not concerned with the fact that you're only dealing with the mouth rather than the entire body? And second question, is it something that you get bored of? If we can get a quick answer, Zain.
Yeah, that's a good question. So it's the fact that I was dealing with just the mouth, which actually attracted me to it, because I didn't want to really go below the neck. And then I like the fact that there was no kind of, not life and death situations involved, because they're not really dealing with the whole body, it's just the mouth aspect. Like I said before, the mouth is very broad. So it's not even just about teeth. You've got oral diseases, oral cancers that we also look at. And then you can specialize in root canals, pediatrics, oral surgery, so different parts of treatments in the mouth itself. So it's not as limited as people think it is.
Thank you, Dr. Zain. Right, next question. Question for Dr. Saad. Question is, why did you choose biomedicine? Was it worth doing it? And also, do universities like King's value it?
Did you mean biology and chem? I didn't get the question. I didn't choose biomedicine, so I'm not sure what was the question.
Not a problem. We'll give that one a pass.
I did biomedical science, if you ask me. Main reason why is because life dentistry didn't get it. That's why I went to biomedical science, so I could build up any work experience, still be within a degree, still be working in the meantime, and reapply it at the end of dentistry, end of biomedical science for dentistry, basically. But I know other people who've applied, like after first year, after second year of biomed, they didn't have to finish the whole degree to get a place. And it's quite common, because as a mature student, I think universities appreciate that a bit more, because you've had a degree, you know, they know that you can study and handle higher education. So you might even look stronger as an applicant after doing a degree compared to applying straight after A-levels, if you don't get in that.
Okay. Another question that a lot of students are asking is they're asking about work experience. They're asking, you know, during this pandemic, how do we gather some work experience? If we can do a quick 20 seconds from each person on the panel, how would you recommend people acquiring work experience? If we start with Dr. Faiz and Dr. Tasnim.
So regarding work experience, yeah, it's tough not only to get work experience, but even when you're there, how much experience are you actually getting? Community pharmacy, if you want work experience, I think generally they're running quite normally, just limiting the number of patients that they allow into their pharmacy. In general practice, we do have students, medical students and pharmacy students doing their pre-reg. at the moment in the general practice that I work in, everything is pretty much on the phone, and we only call in patients who we feel we need to see in face to face. So patient contact is limited drastically. However, in saying that, the whole aspect of remote consultations, which I think going forward in general practice is going to be very, very big, it gives you an opportunity to learn that and to become very, very well versed in that type of consultation. So yes, there are a lot of drawbacks, but there are some positives and some silver lining to what's going on.
In terms of dental work experience, you need dental work experience before your application. They won't, generally you need to make sure that you've written in your personal statement what sort of work experience you've done. And they prefer you not to only have dental work experience. They want you to be able to see that you've tried other things. So for example, I did pharmacy, a work experience, optometry. They want sort of a varied amount, so that they know that you have made this decision wisely. In order to try and get work experience at the moment, it would be writing into practices, emailing them, phoning them. With the COVID, it's going to be difficult, but hopefully post-COVID, yeah, it's just a matter of approaching the dental practices. Zain could probably answer about hospital dentists.
Give me a video on
Yes, regarding hospital dentistry, it's like we get referrals from practice, a bit more complex cases. We're in theatres as well. But in terms of getting experience for that, I think it's best to just contact the departments and see if they're able to accommodate any students. So any hospitals or practices, any health centres near you, just contact them, call them and see if they're accepting them. Because like everyone said, what we're doing right now in the hospital is very limited. Like normally oral surgery, you would see 10 patients a day. Right now we're seeing like 4. Even 3, because of COVID, everything takes a bit more time. So they might not have space to have a work experience student, but again, it depends on the department and what they say. So it's best to just contact them individually.
So in terms of...
Sorry, Saad, I've just got Shahid added into the panelists. He works in the NHS, he's a manager, and he's going to tell us how you can acquire work experience.
Oh, nice.
So one of the things you can do is request participation in volunteer services. At the moment, the interesting thing is, although a lot of hospitals have suspended access to volunteer services, there are a few specific projects where actually we need fit and healthy individuals, people who don't have any underlying conditions, because a lot of families are disconnected from their loved ones. And what we're doing is we're setting up video calling, getting messages to people, and keeping them connected in other ways. Maybe they're bringing letters or gifts and things like that. So that's a good way to get work experience if that's something that you haven't got at the moment.
Also, another question for you, Shahid, is during this pandemic, a lot of people have been made redundant. A lot of people are losing their jobs. One area that is always in need of jobs is the NHS. So for people who are looking for opportunities within the healthcare industry, what jobs can they apply for and how can they apply for these jobs?
So actually, the interesting thing about the NHS is, you know, it employs 1.3 million people, and only about just over half of those are clinicians. A third to nearly a half are working in non-clinical roles. And so the direct access route for many people, if you've just finished a university degree, or you're thinking that I want to come in at a level where I can get a qualification, is the NHS Graduate Management Trainee Scheme. And you can go to a website, NHS website called graduate.nhs.uk, and you can apply to different levels of the scheme. As you're working, you also get a qualification. So you'll get either CIPFA, a CIPD qualification, or an informatics qualification. So there's lots of opportunities for graduates, certainly. Even if you're not a graduate, there's also opportunities. So very many people, like, for example, there's 2 chief execs who work in the NHS right now who started out at the bottom of the ladder in terms of the NHS. One of them, he was a porter. He's now the chief executive of Colchester and Ipswich hospitals combined. And another one, he was a secretary to a doctor. So there's definitely huge opportunities in the NHS if you're willing to start at the bottom, or if you're able to get through that NHS graduate management training scheme, although that is highly competitive.
Okay, Jazakallah for that. Again, we have lots and lots of questions coming in. A lot of them are being repeated. People asking for a good UK CAT score, anything north of 650. People are asking for good A-level subjects, the sciences, the maths, then subjects like history, psychology, English are strong A-levels, but mainly they're looking for is the sciences and maths. What I want to do very, very quickly is I want to go through the panelists and I want to ask them for a maximum of 10, 15 seconds. If they could just give one sentence as to why they chose that specific career. So if we could start with Dr. Zain, quick 10, 15 seconds.
It was rewarding regular patient contacts, dealing with people of all ages and doing complex treatment in a normal daily routine and practice.
Okay, Dr. Faiz, Dr. Tasnim, quick 15 seconds. Why those careers?
For me is being able to help people and having patient contact. I think that should be something that any clinician should want to do, because you're gonna get it one way or the other. So you might as well like to do that. So yeah, definitely regular patient contact, being able to really make a difference in people's lives.
For myself is definitely the hands-on aspect on a day-to-day basis as well. It was you get to be creative at the same time, and also definitely you have to go out of your way to help these people and make a difference to them. And a lot of the time in dentistry, you're repeating yourself again and again and again, but you need to try and get through to that person, and it does take a lot of patience and empathy to do that.
Okay, can we go to Dr. Amin, quick 10, 15 seconds. Why medicine?
It is a fascinating degree. It's always evolving. There's always learning. It's highly varied as well. You're not always just treating patients, but you're talking to people. There's a teamwork element. There's research you could do in your own time. The technology is being incorporated into medicine these days, so it's an evolving field, and it's unique. Not many jobs are like medicine, so that's why.
Okay, Dr. Saad, quick 15 seconds. Why did you choose to study medicine at university?
Why medicine? To be honest, my biggest motivation was when I saw the Muslim medics at Hajj helping out the Muslim Ummah. I thought it's a great way of how they are using their skills and profession for such a noble cause, and that attracted me towards it. And that has been the case, that having been able to help people and knowing them on a long-term basis, having a relationship whilst helping them is something that really attracts me to it. And that's an honest answer, not an interview answer, but it actually is quite satisfying. So that's the reason why I went into medicine.
Okay, Sister Sarah, why nursing?
I chose to go into nursing because it's a really rewarding job. You see patients when they're at the absolute lowest, and being able to help them to the point where they can go back into the community and look after themselves is really important to me. No 2 days are the same. Like, you go into nursing, whatever happened yesterday might be completely different to today, and you can specialize into a lot of different branches, so you're not stuck in one place. There's always room for growth.
Shahid and Shahid.
Yeah, so I think the other panelists have kind of said many of the things I would say, but if you're a non-clinical member of staff and you're a senior manager, one of the things you can do is have an impact on a wider population. One of the areas I began in is public health, and we know that there's huge issues in the Muslim community around particular long-term conditions. It's an opportunity to have an impact on that.
Okay, just before we take some more questions, I just wanted to add in a few points from my experience with medicine, especially because that's the one most of the people are asking for in the comments. Now, in my opinion, I think medicine is one of the best careers in the world. You know, there's a hadith that comes to mind, and it's the best of people are those who bring the most benefit to mankind. And honestly, working with all the different careers, working with a lot of people, hearing their interests, one of the things we share, our moral values, one of the things everyone wants to do is to help people. You know, that's something that brings you happiness, and that's second to none. You know, having the ability to save someone's life. Can you imagine the feeling of going to work one day, going in, and you're there and someone's got a problem and you solve that problem, you save that person's life? Imagine how you feel on your way home. You're going to have a massive smile. So brothers and sisters, anyone who wants to study medicine, I will tell you, go for it. Just like every job, there are pros and cons. You know, some people say, you know, the hours are long. You have to study for 5, 7 years. You're going to be this much years old by the time you finish. So what? Brothers and sisters, this is a career where you are helping people. You are making an impact on their life. You are saving their lives. So anyone who wants to do medicine, I would say go for it. It will be the best decision that you make. A lot of people want to study dentistry, optometry, pharmacy. My advice would be do your research, speak to these people. Towards the end, I will get the panelists to let you know what their LinkedIn profile is, and you can ask them questions. But please, 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 brothers and sisters, whatever you want to do, research it fully, understand it, and go for it. Don't let anybody tell you you can't do this, your grades aren't good enough for this, you cannot do this. Forget them. What you do is you put in your work, you do your utmost, you go for it, and Allah will make it happen. I also want to give people some more advice. You know, like I said, there's so many opportunities out there, but people just don't know about it. I'll give you an example. If you want to find work experience and people tell you it's hard, do not listen to them. There are easy ways out of it. For example, if you go onto Google and if you type in hospitals and you write down doctors, you can find 100, 200, 300, 500 email addresses. It's going to take long, but it's worth it. Go on Google, find as many email addresses as possible, send the email to yourself, blind carbon copy about 500 doctors. Send the same email. Hi, my name is so-and-so, and I'm a student who's interested in joining the field of medicine. I'm finding it really hard to get work experience. Is there something you could do to help? Thank you. Send the email and see what happens. If you're out and about, you're on the train and you see a doctor, speak to them. Tell them that, you know, you're interested in medicine. You guys do an amazing job. I want to join as well, but struggling to find work experience. Brothers and sisters, go out there, network. If anyone is looking for work experience in medicine and they can't find it, go out there, network. Go to hospitals, walk in the corridor, bump into someone accidentally and say, you know, sorry about that, love the job that you're doing. How can I get involved? You know, you can find these opportunities. You just need to put the effort in. If you're struggling with UK CAT, go onto Google and type in UK CAT help and have a look. There are courses online. You pay for them, they'll be worth it. Read the reviews. Are they good? Yes, sign up. Anyone who is struggling, who needs difficulties, do speak to people. Go to these universities, ask people what they study, ask them for help. Brothers and sisters, if anyone is really, really struggling with getting into any of these careers, struggling with work experience, then there's a way you can get into contact with us. We have an Instagram page called Spot Careers. If anyone is struggling to find work experience, if anyone is looking for opportunities, or if anyone has any questions, you can log on there and ask. You can head over to the MYI website. If you've got any questions, ask. Brothers and sisters, there are people out there who want to help you. We have our panelists here today who are giving up their time to help you. So people are willing to help. You just need to come forward and ask the questions. We're going to spend the next 5 minutes firing through these questions. So if you have any questions, please be specific and we'll try and get them answered as soon as possible. Okay, do you want to give him the question? Yeah. Right, Rehana, you've raised your hand. Do you want to ask your question?
She put the hand down. Now, Rayan.
Okay, Rayan, you've got your hand up. Do you want to ask your question? Yeah, Rayan.
Can you hear me?
Ready? Yeah, we can hear you.
Yeah. Let me know my question. Okay, so I have a question for the medics. I have a few questions. Sorry. So, is there time to deal with another career as a medic? For example, I'm considering doing a business. So, would there be time to have a business alongside being a medic? Another question is, what's his life like as a junior doctor? I've read a book by Adam Kay.
Sorry, brother. Just because we've got so many people raising their hands, if you can ask one question, and we'll get that answered quick. We just got to move fast because we're running out of time. Sorry.
Okay. So it's just a work-life balance as medic. Is there a lot of time to do other stuff? Yeah, that's it.
So, do you want to answer that? Quick, 20 seconds.
Yeah, so it can be a hit to your work-life balance. I think in university, you live a nice life. You're in control of your time, and it's very easy to do things when you want.
No, I can't.
When you start working and you're being asked to work more hours than the common person, then it can make you less productive for a bit. But a lot of it is just an adjustment period. You know, I've been in the job now for 2 months, and it has hit me a bit. It's adjusting to everything. But if you're a well-organized person and you know what your objectives and goals are, you will get out of it, and you will eventually be able to balance. And there are many people who do many things. You know, I've got friends who are YouTubers as well as medics, and they do other things. You know, so it's very common to do a lot of stuff. It's just about how well you manage yourself and your time.
Okay, next question. Zain, quick 15 seconds, Dr. Zain. Best advice you would give to someone about to do their GCSEs for dentistry?
Best advice, like Armin said before, just be organized. Don't try to cram stuff in because it won't help with your learning. And obviously try and do the best you can. You want ideal results, and then see what the universities are looking for when you do get your results, if it's suitable to apply to them, and if they're looking for other kind of grades. And then A-levels wise, extracurricular wise, again, see what the requirements are so you know where to apply and you're well suited to go there. And then maximize your chances of getting in.
Okay, Jazakallah khair. Next question. If I have predicted
AA, then I can't apply for King's EMDP and I can apply for MBBS, correct? Quick answer, Dr. Amin. If you got predicted A-star AA.
Yeah, no, I actually got predicted A-star AA when I did my A-levels, and the entry grades at the time were lower. They were BBB, but I got predicted A-star AA, and I still got given an offer. So at King's specifically, I don't think they have an issue with it. Obviously, I applied 7 years ago, so definitely double check. But off the top of my head, I don't think that's an issue at all.
Jazakallah khair. We've got some other questions. What are some good alternatives to medicine if people don't get into medicine? I would say that some of the best alternatives out there would be dentistry, pharmacy, optometry, radiography. So do have a look into those careers. What I want to do is, a lot of the other questions are similar to the above. Some people are asking about the recording for the whole careers event. We will be making them into small segments and be uploading them onto the Spot Careers Instagram page. Another question asks about salary. If we give a quick fire, we're going to go through the panelists. If we go through them one by one, if you just give us what you think a rough estimate of the salary is after 5 years. If we start with Dr. Zain.
So after 5 years, you'll have to ask Dr. Tasnim to confirm. But DFT, your first year training, it's about 25,000. In hospital, it's about 35,000 for DCT, core training. But it can go up to about 40, depending on how many on-calls you do. And in practice, I think it depends on how much private work you do. but I'm not sure, maybe the average might be about 50 or 60. It depends on your balance between NHS and private work and practice, really.
Dr. Faiz, Dr. Tasnim?
In terms of pharmacy, as a pre-reg training year, you're looking at about, I would say under 20, depending on how generous the people are to you. Then as a first year pharmacist, you can earn anywhere up to, I'd say, 35 to 40 in community pharmacy. And then it's based on banding in hospital. So depending on how experienced you get. As a general practice pharmacist, clinical pharmacist, as a senior pharmacist myself, you're looking at anywhere between 55 and 60, depending on how good you can negotiate your contract. And then there's always the option to do locum work and other things, and you can work later shifts if you want to earn more. So there is flexibility and there is scope to earn more.
In general practice with dentistry, it depends on whether you're just a general dentist or whether you do specialist courses. So what Zain said was correct, but it depends. You can go into only private practice where you will be earning more. You can become a specialist, which requires further training, and then you could work in, again, you can work in practice. You can be earning 100K plus. It just depends on what you're doing. You might be doing implant dentistry. There's such a variety in general practice. If you're just a general NHS dental practice, and sort of working in an NHS dental practice is always NHS and private mix. It depends. You are self-employed, so it just depends on the amount of work you do. There's no salary. It just depends on what you do on a day-to-day basis.
Okay, give me sound. Quick one, Sister Sarah, and then we'll go to Shahid. Salaries after 5 years, please.
I'm not 100% sure, just because I haven't graduated just yet. I know the starting salary is around 25 to 27K, and then depending on your band, it increases, and depending on whether you want to go private or not. If you want to specialize, then you can go into more training, and then later on you can work your way up. But I'm not too sure on the salary exactly.
Okay, and Shahid?
Yeah, so if you're on the NHS Graduate Management Training Scheme, you join the pay scheme called Agenda for Change. If you Google Agenda for Change NHS, you'll get a list of all of the bandings throughout the whole of the NHS, and you start around 24,600, and after 5 years, you'd get to 30,000. But the likelihood is you'd move up fairly quickly, and the banding extends for managers all the way through to 104,000 plus.
Okay, Jazakallah khair for that. Just before we end the session, I just want to say a few words. Brothers and sisters, if anyone has any questions or queries, please do go and log on to the MYI website, or you can visit the Spot Careers Instagram page, and you can ask your questions and someone will answer them at a later date. Furthermore, I also want to tell you guys a little bit about a project called Spot Project. We specialize in education, food, and water. So do have a look at our charity Spot Project. We're on Instagram and Facebook. So when you get some time, do check it out. Brothers and sisters, we thank you for giving up your spare time to find out about some careers. And as we mentioned, there are so many opportunities out there, as the panelists have also mentioned. So please do have a look for these opportunities. Go out there in the big world and explore, network, speak to people. If anyone is shy about approaching or speaking to people about their careers, get in contact with us. Get in contact with MYI, get in contact with Spot Careers, and you can ask anything that you want to ask, and we will do our best to get you the answers. Just before we move on to the next session, I want to hand over to a representative from MYI who's going to tell you a little bit about what they do and what they offer. Jazakallah khair. Assalamu alaikum.
Wa alaikum salam.
ورحمة الله وبركاته. Bismillah walhamdulillah wassalatu wassalam ala rasulullah. I just want to say Jazakallah khair, big Jazakallah for all the professionals that have come and have contributed to this wonderful program. It's amazing to see how many people that have logged in, how many questions that have been answered, and the interaction that is taking place. Alhamdulillah, it's been an amazing day, alhamdulillah, and we've got a lot more coming your way. We've got the apprenticeship schemes that we're going to be talking about, and then we're going to be talking about UCAS forms, interview techniques, etc., etc. Now, just a quick thing from me, brothers and sisters, especially my young brothers and sisters, you're at a very delicate age, and we're in a situation where there's an information overload and there's a lot to take in. But this is something that you do need to think about. And why do I say that? Why? Because you're young and you need to utilize the time that we have and utilize the time that you have. And we know from the guidance of Allah subhanahu wa ta'ala in Surah Al-Asr, where Allah subhanahu wa ta'ala swears by this aspect of time and mentions that time is something that is limited. It's something which goes and you're in loss. So this is one aspect of your life that you really do need to think about. If you try to account the amount of hours or days that you're going to be working, on average, we're talking about maybe 30 to 50 years of your life you're going to be working. So you need to start thinking about what that life or what that the time that you're going to be the time you're going to spend working, what's that going to be like? And you want it to be pleasant. And if you want it to be pleasant, then you need to start thinking about it now and planning towards it. It's really, really important that you take into consideration what your interests are, and you utilize all the opportunities that are available. And this career fair is a fine example of that. Utilize the resources that we have. We have, alhamdulillah, alhamdulillah, thumma alhamdulillah. We have so many professionals in so many different fields, and you can really tap into that in order to find out how to get into that or into that specific field. I remember when I was at university, I was studying one course and then I thought, you know what, I can't really go into this or can't do this course. Why? Because I thought, you know what, economics is not really a good subject. It's not worth studying because I'm going to end up in banking. Not to say anything about banking, but I thought, oh, you know what, banking industry, I'm not sure whether I'm allowed to go into that or not. I didn't have much guidance, and there wasn't that many opportunities for people to give that type of guidance. So take advantage of learning from others, speaking to others, and benefiting from others. Another quick thing, inshallah, as you know, this event has been organized by a collaboration of different organizations, and Jazakallah Khair to Spot Project and to YPN and Muslims in Row and MYN. MYI is a youth organization that is there to really build on the skills that our youth have so that they can be the best that they can possibly be and be steadfast in their deen and be proud of being Muslim. And one of the best things that you'll find in your life is that to be a Muslim professional you're in a place of dignity. It's a wonderful feeling. Why? Because what you do is to bring about good, and what you do, you're passionate about your work. You want to make a change. You want to make a positive impact. So whatever job that you wish to do, make sure that you're thinking about, you know what difference can I make? And also think about this. You have you have envisaged a certain lifestyle. If you want that lifestyle, then think about how you're going to achieve that lifestyle, how you're going to reach that goal. And if you've got a goal in mind, then you need to start taking those steps back and thinking, all right, what's the step-by-step or structured approach in order to reach that lifestyle? So brothers and sisters, it's time for you to plan. And I say brothers and sisters, it's not just brothers that need to start thinking about this. It's also sisters as well. There's many opportunities out there for brothers and sisters and for you all. I wish that Allah subhanahu wa ta'ala blesses and puts barakah in whatever you do. And I wish you all the success in this life and the hereafter. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. And our next session, inshallah, is going to be on apprenticeships, which is going to start very, very soon. Jazakallah khair.